welcome back to my channel. My name's Sophie and this channel is chronicling my journey of living my best life with multiple chronic health conditions. Today I wanted to do a health update. I do have health insurance now. I got health insurance on March 1st, so I have had quite a few tests done already. I've almost actually met my deductible of $1,500 and it's only March. So yeah, I'm just gonna read over what I got. So I did get lab work done on March 1st and my sed rate was high, which it's normally high. It's a measure of inflammation. My creatinine was elevated. My cholesterol is really high. That could be because I was eating burgers for a couple days before. I'm sure we'll see what it is again in a few months when my diet stabilizes, but I'll come back to the high cholesterol in a little bit. I did finally get some random tests I've been wanting, so I got my B12 and folate levels, and they were both elevated. My B12 was almost twice as high as like the upper limit, and then my folate is just greater than the upper limit. They don't give an actual number. I wanted further tests to see why they were high, but they weren't ordered, so I guess we're not gonna figure that out. I did get my iron checked again, and my iron is now normal, which is good. I am taking an iron supplement, so I was expecting it to be better. I just didn't know how much better. And then I had a urinalysis, and there was blood and protein in my urine. And again, I wanted a 24-hour urine to see how much blood, protein, and creatinine were in my urine, and that also was not ordered. Then for my rheumatological workup, one of my complements is still elevated, which isn't connective tissue because then it would be low. But hopefully when I see the allergist immunologist at Cleveland Clinic in about a month, we will discuss the complements and see if we can figure out what's going on. Obviously, I don't know how that appointment's going to go. I don't have high hopes for any appointments anymore because, as I've just explained, with these abnormal results and no further testing, just because you get an abnormal result doesn't mean they're actually going to try to figure out what's going on. And then my histone antibodies were elevated again, still. They've been elevated every time they've been tested. My local rheumatologist says that it's just a measure of whether you have like medication-induced lupus, but it's been elevated, like I said, the entire time since 2015, I believe, and I'm not on any medications that are known to cause drug-induced lupus. When it was elevated at Cleveland Clinic, they said it could be drug-induced lupus or another connective tissue disease, but again, they didn't investigate as to whether or not it was another connective tissue disease. So, yeah, I don't know what to do about that. Again, I'll bring it up to the immunologist simply because they work with the immune system, so maybe they have some input as to what it could be. And then I did have a chest x-ray, which was normal, and after that, a week later, I had a chest CT scan. I just had that yesterday on Friday because I have been more short of breath lately. My heart rate's been higher when I go on my walks. I think I mentioned my oxygen got really low the other evening. I think it was like about 2 weeks ago. And they didn't see any acute process going on in my lungs. So no new pneumonia or anything. But I will say this was not a high resolution CT scan, which is what I normally get. It was just a regular CT scan. So it's not a complete apples to apple comparison. They did see minimal streaky densities in a couple areas. One area they do say that it's on change, so I guess it's been there for a while. And the other area they didn't say whether it was new or not. So I don't really know what minimal streaky density means. That might be something I'll eventually ask a doctor about, but right now I don't have a local pulmonologist, and the pulmonologist I see at Cleveland Clinic is the interventional pulmonologist for my collapsing trachea. Yeah, maybe when I go in April I will get another high-res CT scan. I'm not really sure. I do see the interventional pulmonologist for a virtual pre-op appointment on the 20th of this month, so here in a couple weeks, week and a half or so. And obviously I will update you guys on what that shows or what happens with that. We'll be discussing the stent placement. That is the plan for my visit in April, so that will be interesting. And then an unusual test I finally had done after hearing my heart beating in my ears for over 3 years now, or going on 3 years. I'm not sure exactly when it started. I finally convinced a doctor to do a carotid ultrasound. I had actually recorded what I heard for them. I have this device called a stethoscope that allowed me to record what I was hearing. It's basically what's called a bruit, which is when there's any abnormal swishing or whining noises when you listen over an artery with a stethoscope. So I got this device. It's a stethoscope, and it can record what you're hearing. So I did record what I was hearing, and it's just this whiny, high-pitched sound to my heartbeat when I was listening up by my ear. I put it on one of my YouTube channels, I don't know if it was this one or not, as a private video, and shared the link with my doctors, and judging by the 0 views, they did not look at it. But I did finally get one of them to order the ultrasound. I will say that the Cleveland Clinic doctor, the cardiologist, said that he wasn't worried about it because I was too young to have anything wrong with my carotid arteries. That maybe it was subjective, but since I literally have a recording of it, it's obviously not subjective, but that's a rant for another day. So anyway, carotid ultrasound showed 50 to 69% diameter stenosis due to either stenosis or tortuosity. So stenosis is just a narrowing. So they don't say what caused the stenosis. Tortuosity would be if the vessel wasn't straight, it was sort of curvy, and though that could cause what they heard. It was actually the recording, not necessarily the image of the vessel, that they found was abnormal. And it was just on my right side, which is interesting because I normally hear it on my left, though I have been hearing it on my right lately more than my left, but it started on my left. So they recommended I have a CT arteriogram or a CTA, and the doctor did not order it. I got a response that my carotid arteries looked great and there was no plaque, which is true. The images does not show plaque, but the report says, and I quote, "Correlate with CT arteriography recommended. Tortuosity may elevate velocities." So the velocity is what they were measuring and what was elevated on my right carotid artery. So I did tell the doctor, yo, did you not see this 50 to 69% stenosis? I want the CTA. And they did order it, but I don't think I should have had to ask for them to order it. I mean, it's recommended. There's a blatant abnormality. But yes, that is also on March 20th. So on the 22nd, which will be a Wednesday, I will update you guys on the Cleveland Clinic plan, as well as the results of the CTA of my neck. I'm very interested to see what the CTA finds, simply because of where I was hearing it originally, up by my ear, and the fact that they said tortuosity could be the cause of the stenosis. That could be related to a condition called fibromuscular dysplasia, which, if that is what I end up having, I will make a video on it. But yeah, so that is my medical update. Sorry this is so long, but it's me, and it's never a dull time when it comes to medical stuff, unfortunately. But that is going to be it, and I will talk to you guys in a few days. Bye, guys.